The check-in app has officially checked out.
Yay, no check-in.
From today, customers will no longer need it when entering shops, gyms, beauty salons or taxis.
I honestly think that's a fantastic idea.
Doesn't seem to be much point now that contact tracing is no longer occurring.
I'm glad to not have to do it all the time.
But they'll still need it to check in at pubs, clubs and cafes.
We still need to use the check-in app to ensure people are vaccinated. Until that mandate gets removed, then we're just going to have to continue to use it.
The changes come because the Omicron peak has passed.
It appears that we hit our peak on the 4th of February, so we are now showing declines across the state.
Just over 4,000 new cases were reported today, 1,000 fewer than yesterday. There are 2,400 people in isolation. In mid-January, the figure was more than double that. And the number of public hospital patients is falling, though currently stable at 663.
The trend, though, is rapidly down across Queensland.
However, the number of COVID deaths is up. Today, there were 19, making it one of Queensland's deadliest days.
And deaths is often the very last measure that starts to decline.
9 of the 19 people who died were unvaccinated. Only 1 had received a booster.
We're seeing a disproportionate a number of elderly people dying who have not received the booster.
10 were in aged care.
It is an absolute tragedy. It's not only a failure of policy, it's a moral failure on behalf of the federal government.
The Nurses Union says the vaccination rollout in care facilities has been a debacle.
There's tens of thousands who haven't got their vaccines and up to their boosters. They should be due their boosters now.
The State Health Minister says families can make alternative arrangements for elderly relatives in care.
Our vaccination clinics are available for walk-ins if anyone wants to walk in with their relative.
Sally Eales, ABC News.